We'll speak about an important aspect of the development of the essential important system in the body, that is the nervous system development. I think you know all that by the gastrulation, which is that occur at the third week of development, there are three germ layers are formed: the ectoderm, mesoderm, and the endoderm. By the third week of development, there is on the dorsal aspect of the embryo, in the front of the primitive node, there is a thickening like structures runs along the ectoderm, and this will form the neural plate by a process called neurulation. This slide, upper slide, is showing you the neural plate development. It is a thickening. What is the neural plate? It is an ectodermal thickening tissue of the ectodermal layer that's forming the initial or the base of the development of the nervous system. Following that, these neural plate will invaginate inward, and on each side of this invagination there is a tube-like structures forming two arms. These two arms are called as a neural fold. This neural fold or the neural plate, initially it lies over the notochord. The notochord is a rod-like structure of thickening in the mesoderm. This notochord is very important in the initiation and differentiation of the overlying ectoderm into the formation of the nervous system. This slide gives you pictures how the neural plate will form a rod-like structures. Anteriorly, it will differentiate into the central nervous system, and posteriorly, it will differentiate into the peripheral nervous system. And the peripheral nervous system, from there, it will give you, as we said, there are specialized cells that lies on the east side of the neural fold called neural crest cells, will differentiate it into the preganglionic and sympathetic and also parasympathetic nerve, and also give you the whole the parasympathetic nerves, and also nerve tubes and all nerves, and the dura mater of the central nervous system. So the process of neurulation, it is the process whereby the neural plate is formed. It will form a tube-like structures because both end goes up, the lateral fold, the neural folds. It will unite, forming a groove-like inside and forming a rod-like structures called the neural rod. And this will form the initiation of the origin of the central nervous system, and it will elongate and bend with the lateral bending and lengthening of the embryo, and it will remain open to the outside, to the amniotic cavity, by anterior and posterior neuropores. Show how this rod-like structure is formed, the neural rod, and it will form a tube-like structures. And you can see on each side of this neural plate there is a somite here on both sides, and it is open to the peritoneal to the amniotic cavity by the anterior neuropore and posterior neuropore. I think this slide is more clear how this tube structure is opened. You can see here this is the pericardial bulge, and over it there is a rod-like structures. Here it is the neural rod, where the anterior opened cranial neuropore and caudal, anterior and posterior. Anterior cranial means anterior, and caudal means posterior neuropore opened with the outside by these pores, which is evident at the embryo age 22-23 weeks. That is the third week of embryonic development. You can see here how these neural cord going up, forming neural groove. That is the process of neurulation exactly. And some cells are from the neural fold are migrating between the ectoderm and the neural tube called the neural crest cells. These neural crest cells will forming the autonomic and sensory nervous system. So the neural tube is formed by the fourth week and detached from the surface of the ectoderm to assume much more deeper position. It will start to differentiate anteriorly into three vesicles-like structure, or forming what's called the brain tissue, and the caudal part will form the spinal cord. And then these cells anteriorly will differentiate into three constructions. That is the forebrain, or we call it protencephalon, midbrain, mesencephalon, and romencephalon, which is the hindbrain. And the rest of the neural tube will form the spinal cord. Each part of these three brain vesicles, the protencephalon, the mesencephalon, the romencephalon, will further differentiate to more parts. So, for example, the protencephalon will be differentiated into two constructions, much anterior big dilatation or vesicle called telencephalon, and the other part small like structures diencephalon. The mesencephalon will stay as it is, and the romencephalon will form the metencephalon and myelencephalon, and the remaining will form the spinal cord. So by fifth week, the brain tissue are dramatically seen as vesicles, and these vesicles will further differentiate to give major other structures and cavities of the brain. For example, the telencephalon, again the protencephalon will differentiate into two parts, the telencephalon and the diencephalon. The telencephalon will give the two cerebral hemispheres, the lateral ventricles, the basal ganglia, the white and gray matter of the brain, while the diencephalon will form the hypothalamus, the thalamus, and the third ventricle. Furthermore, the mesencephalon, that is the midbrain, will form the midbrain, and there is a connecting duct between the lateral ventricles and the third ventricles and the metencephalon by the cerebral aqueduct of Sylvus, and then the metencephalon will form the pons, the medulla, and the fourth ventricle. So the third and fourth ventricle, I mean the diencephalon and mesencephalon, is connected by the cerebral aqueduct of Sylvius, while the myelencephalon will form the medulla oblongata and the central cranial. These are central canal. These are very important. You should remember very well. You know the details of the cavities and structures of the growing of the brain tissue is much more hard and is much more steeper and rapid growth rather than the growth of the bones. I mean, so that the developing brain will show some folds in characteristic way. There is, if you can see, if you see in the anatomy, the brain tissue, there is a area which is folded, and there is elevation and depression. The gyri and sulci, the elevation and sulci, these are because of the rapid growth and extension of the brain tissue in relation to the slow growth of the brain tissue. And these two cerebral hemispheres will force to take a horseshoe structure, and they grow rapidly and cover most of the diencephalon and midbrain. The gyri and sulci develop at the end of the third month and increase the surface area of the cerebral cortex. That's why they look like folded. We described before the extension or the exposure of the anterior and posterior part, or the cranial and caudal part of the neural tube. From the anterior part, they, as we said, they remain connected to the amniotic cavity by the anterior or the cranial neuropores, posterior neuropores. The closure of this neuropore, we said that by the third or fourth week, the differentiation of the brain tissue and element is continued, and by about 25th day of development, the cranial neuropore will be closed, and followed by about 2 days later, by 27th day of development, the caudal neuropore will close later on, and the central nervous system, represented by the closed tubular structure with narrow caudal portion, and the spinal cord, which much more broader cephalic portion, the brain. So as we said before, this road will have expanded anterior part, the brain, and narrow rod-like structure posterior, that is the spinal cord, the typical appearance of the central nervous system in the human body. Of the anterior neuropores is important. Why? Because if it is failed, this will result in failure of the cranial bone to develop within the cerebral hemisphere, as what is called clinically evident clinical condition called anencephaly, that is absence of the brain tissue and bones of the head. This is typical feature of baby with anencephaly. Most of these baby will die shortly after birth. So they are small face, protruded eyes, and you can see there is absence of the cranium of the forebrain, and also absence of so the brain tissue is exposed. This is anencephaly. Condition of the central nervous system development is the spina bifida. Spina bifida, that means there is abnormal development of the spine. There are three types of this condition: spina bifida occulta, meningocele, and mengomyelocele. In spina bifida occulta, this is it's more common, and it is much more the mildest form of the condition, in which there is abnormal development of the vertebra of the spine and the lower spine, and you can see here there may be a dimple at the lower back of the baby with some hair tissue, and that is the spina bifida occulta, but it's closed. The other form is meningomyelocele, here where the lower part, there is abnormal, in addition to the abnormal development of the vertebra, there is a swelling like cyst-like structures in the lower part of the back of the baby with full of CSF, and because the meninges are protruded in that cyst, and there is you can see this baby with a cyst-like structure in the lower back, and this cyst is filled with CSF. This condition also can sometimes be corrected, and it's okay, but the most different, or the most difficult part is the mengomyelocele, in which there is a protrusion at the lower part of the back of the baby with a piece of meninges together with the spinal cord, in which condition there may be also absence of the function of the lower part of the body. There may be paralysis of the lower part of the body, that is the lower limbs, and even sometimes incontinence, fecal or urinary incontinence. Is cranioasthesis, in which there is entire neural plate fold it's failed to fold, and here the CNS will be open to the amniotic cavity, and most of these conditions luckily are of stillborn fetuses. Stillborn, and the baby is born dead. So you can see further that these and most abnormalities are very important and very critical in baby's life and family life, their family life. So we have, can we test these any test for these abnormalities antenatally? Antenatally means test before birth. Natal means birth. Antenatally means before birth. Postnatally, after birth. Is it possible to detect these abnormalities because they are dangerous? They may be associated with other fetal risk of stillbirth or other neurological sequelae or effect or complication during further development of the baby. Yes, sometimes we can detect these abnormalities by many types of tests. Some are non-invasive, others are invasive. What is the difference between the non-invasive and invasive? Non-invasive, that means you didn't injure the mother too much. You can simply you can aspirate. When you aspirate some of the blood to take the plasma, you detect sometimes some sort of test which is called cell-free DNA in the maternal plasma. Can be done at about 10 weeks of pregnancy, gestation, and you can detect certain anomalies by sending this blood for the lab for PCR, that is or for detection of certain particles that will help in the diagnosis. This is a non-invasive test. You only do a puncture. Ultrasound, for example, is a non-invasive test that can be used to detect certain abnormality by looking at the baby structures in the ultrasound. This is a non-invasive. So cell-free DNA is non-invasive. The ultrasound is non-invasive. Other tests, it's called amniocentesis. What is amniocentesis? It is a procedure which is performed. It is done. Performed means done between the 14th and 20 weeks of gestation. The sample of amniotic fluid is taken to detect or screen certain fetal anomalies. It is a diagnostic test. First trimester test looks for the risk of certain disorders as Down syndrome, trisomy 21, Mongolism, trisomy 18, trisomy 13. Other certain neural tubes can be discovered by amniocentesis. This is exactly what the procedure. This slide shows exactly the procedure of amniocentesis. You did it under ultrasound test or ultrasound machine. You lie the mother on her back, and you specify, localize the placenta where, because if you puncture the placenta, there may be bleeding, which is very important and risky to the life of the mother and the baby. And you can do a puncture by CSF needle, passed under local anesthesia through the mother's bladder at right perpendicular 90 degrees, and you empty the bladder of the mother before, and you can take some fluid. You can do it for fetal infection detection, for genetic diagnosis, for certain chromosomal abnormalities. You can look with this test. So it is very helpful in the antenatal detection of fetal abnormality. Antenatal test is a test for alphafetoprotein test. It is a test. This alpha-feto. It is a protein from its name. It is a protein synthesized in the fetal liver and can be exposed to the maternal circulation also. If you aspirate some of the maternal plasma, you can detect this alpha-fetoprotein when there is. It may be high in certain condition and can be low. So it is very important and helpful in the diagnosis of second trimester investigation for fetal abnormality. Be high in certain birth defect, certain neural tube defect, and also in Down syndrome it will be too much little, or maybe sometimes it is high in multiple birth or a twin, and sometimes wrong calculation. They'll give you a much misleading wrong result about alpha-fetoprotein. So it is very helpful in the diagnosis. Can these fetal abnormality can be a part of from genetic or a chromosomal abnormality, can be caused by external factors? Yes, some of factors such as by certain drugs called, or certain agent called teratogen, which may be physical or chemical or radiation. It can that is any agent, whether an external agent that can affect the development and the growth of the embryo in utero. It is called teratogen. Such as tobacco smoking, alcohol use, some illegal drugs or illicit drugs use, and so very important in keeping the mother away from these abnormalities. You should advise the mother for use of folic acid and multivitamins during pregnancy to avoid this fetal abnormality. Hydrocephalus is a condition when there is also the CSF abnormality, in which there is, as we said before, normally there is the CSF is an turnover process. It is a moving fluid, not stationary. It is when it produced, it will pass from the third ventricle, from the lateral ventricle, sorry, the third ventricle, from the third ventricle to the fourth ventricle, and then it will pass to the subarachnoid space where it is absorbed. And in certain condition, this fluid will accumulate because of the obstruction through the way of pathway from the lateral ventricle to the third, or from the third to fourth. So there will be fluid-filled spaces, and extra fluid will be collected in these ventricles, and these will press on the brains and the bones of the skull, and it wide these sutures, especially the baby is following a few months following delivery, and they can affect and press over the brain tissue. So brain tissue will be very thin, and the head may be very large. This photo and the above diagram exactly showing you how the fetus will be look like after delivery of the baby having hydrocephalus. You can see that the head is large. There is evident veins because of obstruction, and it will press sometimes on the other parts, the nerves of the eye, the other tissues, and can cause certain problems. This way, to the hydrocephalus, there is a microcephaly, in which there is the vault of the cranium of the baby is small. That is smaller than normal. That is upon which depend the growth of the brain. So if the cranium is closed, it will press on the brain tissue, and the conditions may be caused by genetic chromosomal abnormality, or can be caused by infection or exposure to certain drugs and teratogens. And of course, because of the pressure of the small skull bones, it will press on the brain. There is intellectual disability in most of these cases. And thank you.